Welcome to today's Explainer. Today we're tackling a topic that, let's be honest, usually feels pretty overwhelming. Scary even, right? Shrouded in all this mystery. But guess what? We're going to completely flip that script. We are not looking at cancer as some unpredictable monster in the dark. Instead, we're going to look at it as a biological process, one we can actually understand, anticipate, and, most importantly, fight. By the end of our time together, you're going to walk away armed with this incredible, scientifically backed knowledge that puts the power literally right back in your hands. Okay, 1 and 2. Just let that sink in for a second. It's a staggering, honestly sobering statistic. 1 in 2 people will develop cancer in their lifetime. That means this isn't just some abstract medical topic meant for a textbook. It's universally relevant to absolutely everyone watching this right now. Whether it's you, a family member, a best friend, this disease touches all of us. But hey, instead of letting that number paralyze us, we're going to use it as fuel, motivation to understand exactly what it is we're dealing with. So here is our roadmap for today's Explainer. First, what actually is cancer? Then we'll look at the 3 main treatments, why it sometimes returns, the 50% rule, and we'll wrap up with 6 habits for prevention.
Okay, let's dive right into section 1. What actually is cancer?
Before we can fight any enemy, we've got to know exactly what it is, right? To explain this, renowned surgeon Dr. Yujiro Nakayama uses a truly brilliant analogy. I love this. Think of human DNA as a massive, sprawling library of instruction manuals. Now, our bodies don't just keep the exact same cells forever. We are constantly replacing old damaged cells with fresh new ones. And to do this, our biological copy machine has to duplicate the DNA, an entire library's worth of information, every single time a cell divides. Now, if you asked a person to copy a whole library by hand, they're going to make a typo eventually, right? Well, our cells do the exact same thing. When that biological copy machine gets tired or just makes a random mistake, a typo pops up in the instruction manual. That typo basically breaks the brakes on the cell. It totally forgets how to die, and it just keeps multiplying uncontrollably, eventually forming this mass that blocks normal, healthy bodily functions. And that cellular typo is cancer. Now, it is absolutely crucial to clarify the difference between a benign tumor and a malignant one, because people mix these up all the time. If you have a polyp in your stomach or colon, that's usually a benign tumor. It's kind of like a mole or a wart on your skin. It stays exactly where it is, it's generally harmless, and if a doctor snips it out, it usually doesn't come back. But a malignant tumor, which is true cancer, is a whole different ballgame. It multiplies completely without order. It acts like this hostile invader that actively destroys the surrounding tissue and ultimately threatens the life of the host. All right, moving on to section 2, the 3 main treatments. So when a malignant tumor actually forms, how do medical professionals fight back? Well, there are 3 core pillars of cancer treatment, plus a highly advanced 4th method we're seeing more of. First up is surgery, which is incredibly direct, right? Just physically cutting out the bad tissue. Second is chemotherapy, which uses really powerful drugs that travel throughout the whole body to hunt down and kill rapidly dividing cells. Third is radiation, used to basically burn and destroy the cancer in one specific localized area. And then, building on chemotherapy, we now have targeted therapy. This is where modern science just gets mind-blowing. These are molecularly targeted drugs designed to lock onto very specific molecules that only exist on the surface of cancer cells. They're often combined with traditional chemo to really hone in on the disease, all while trying to minimize collateral damage to your healthy cells. Now, there's this really common myth out there that surgeons just love to cut, or that your treatment basically just depends on the personal preference of whatever doctor you happen to see. We need to bust that myth right here, right now. Treatment choices aren't based on a doctor's whim. No way. No matter what hospital you walk into, treatments are firmly dictated by incredibly strict, heavily researched global guidelines. It's basically a universal medical rulebook. It's built on vast, vast amounts of data, ensuring that a patient at a specific stage of cancer gets the exact treatment scientifically proven to offer the very best chance of survival. Which brings us to section 3. Why does cancer return? This brings up a pretty terrifying reality for a lot of patients. Honestly, it's a question that haunts anyone who has gone through treatment. If the surgeon goes in, successfully removes the entire tumor, and all the scans come back totally clear, why on earth does the cancer sometimes suddenly return, often in a completely different organ, 3 or even 5 years later? Well, the answer lies in our body's internal infrastructure. Think of your bloodstream and your lymph nodes as this massive high-speed highway system.
By the time a primary tumor is actually large enough to be discovered, say it's the size of a golf ball, it has likely already shed microscopic cancer cells right into this highway system. These microscopic cells travel freely through the blood, quietly taking an exit off the highway to lay completely dormant in other organs, like the liver or the lungs. Then, years later, some unknown biological switch flips. They wake up, and they begin to multiply. And this is exactly why doctors often prescribe a few months of chemotherapy even after a totally successful surgery. They're basically sending medicine down the highway to hunt down those invisible, hiding cells before they ever get the chance to wake up.
Okay, let's look at Section 4, the 50% rule.
So we're going to do a hard pivot here. We've covered the heavy medical realities of how this forms and how it's treated, but now we're shifting to our ultimate message of hope, agency, and empowerment. Are you ready for this? Scientific data definitively proves that you have the power to reduce your risk of developing cancer by a massive 50%. Yeah, 50%. Just let that sink in. Half of your risk is entirely in your own hands. This completely changes how we view the whole illness, doesn't it? Dr. Nakayama points out that cancer isn't just about rolling the dice and getting bad luck, and it isn't purely about your genetics either. At its core, cancer is heavily influenced by being a lifestyle disease. The physical choices we make every single day accumulate over years and decades. They're either protecting our cellular copy machines, or they're pushing them toward making those deadly typos. So let's jump to Section 5, 6 Habits for Prevention. Let's see how this actually translates into actionable, daily habits that you can literally start changing today. First up, we've got a massive data shock regarding our diets. The global average for daily salt intake is about 6 grams. But in places with highly sodium-rich diets, like Japan, for example, the average is a dangerous 9 to 10 grams. That's nearly double. And high salt intake is directly linked to an increased risk of cancer, especially stomach cancer. So we really need to actively swap out heavy salty seasonings for healthier options. Things like umami-rich dashi broth or just using more pepper and herbs. Trust me, your cells will thank you for it. All right, here's the master list of the 6 preventative habits. Number 1, quit smoking completely. And actually, side note here, vaping is not a proven safe alternative, guys. It just introduces a whole new set of unknown risks. Number 2, minimize alcohol. Scientifically speaking, 0 alcohol is the absolute best for cancer prevention. Number 3, eat raw whole vegetables. And no, drinking processed vegetable juice doesn't give you those same protective benefits. Number 4, exercise for 60 minutes a day. Now, don't panic. This doesn't mean you need some expensive, intense gym membership. A really simple daily hack, like getting off the train or bus just one station early and walking the rest of the way, that counts as great exercise. Number 5, maintain a healthy weight. And number 6, check for hidden viruses. Let's actually look a bit closer at habit number 5 for a second. The data shows there's this BMI sweet spot right between 22 and 25. Now, obviously, we all know that obesity carries health risks, but here is a critical warning. Being overly thin is just as risky when it comes to elevating your disease risk over time. We're seeing this become increasingly common, especially among young women who are striving for this incredibly low body weight. Dropping your BMI too low fundamentally weakens your body's immune surveillance. It basically makes it way harder for your system to catch and destroy those daily cellular typos we talked about earlier. Finally, we've got to look at the difference between what you can do at home and what actually requires a doctor. You have total control over your lifestyle choices, right? Your diet, whether you smoke, how much you walk, but lifestyle alone cannot fix everything. You've got to proactively visit a medical professional to get tested for silent, cancer-causing viruses and bacteria. We're talking about things like H. pylori. That's a bacteria that causes stomach cancer but can be cured with simple antibiotics. Or HPV, which causes cervical cancer and can be easily prevented with a vaccine. And hepatitis B and C, which lead to liver cancer. You literally cannot diet away a virus. You have to get checked. Wow, okay, so we have covered incredible ground today. We've demystified what cancer actually is, how it spreads through the body, and most importantly, we learned that by mastering our daily habits and just getting simple medical checks, we can slash our risk by 50%. You hold incredible, incredible power over your own health. But for the times when prevention just isn't enough, what happens when cutting-edge technology meets modern surgical treatment? Well, we are diving into that exact question in our exclusive follow-up segment. We're going to be looking at how 3D cameras and anti-tremor tech are doing things that the naked eye just never could. Make sure to check that out, and until next time, keep learning, keep moving, and take charge of your health.